Here we go.
Welcome back to another episode of 50 Cents. Hope y'all like our new our theme music. It's that 50 Cents. So we got some serious topics to talk about today. First thing we're going to do is jump in and let our brother, the voice of reason, talk to us about his latest journey. That makes 2 out of 3 of us here at this table dealing with prostate cancer issues, and we want all men out there just to man go get checked up. But I'm gonna let D talk about how you doing, man. You doing all right?
Doing great. Definitely a subject that is now certainly dear to me. So for those who don't know, I was diagnosed with prostate cancer in December of 2025, and had it confirmed through a second opinion in January. I won't go through all the details. That'll be for another show, but was blessed to be able to go to MD Anderson, one of the premier cancer centers in the country. And so I actually had my surgery on March 3rd of this year, and we are a little bit over a month out, and have had it confirmed that they were able to get all of the cancer. And so I'm just very blessed, and certainly want to publicly thank both Ken and Mike and their support through this time. It was definitely, something that you never want to hear, but luckily, or I won't say luckily, but by God's grace, intervention was timely, because it was discovered that it was a very aggressive form of cancer, a prostate cancer. We found out it was more aggressive than initially thought once the pathology was done on the tumor. So again, just grateful to be here. And as Ken mentioned, we want to encourage you men to definitely get checked. You can do that. Kind of the first thing you do is to get a PSA exam, or get a PSA. And PSA is a simple blood test, and they are able to determine if there's cancer present via that blood test. Then from there, you probably go to a urologist, you do an MRI, you'd have a biopsy done to confirm. Again, won't get into all of the specifics of it, but just want to encourage you to know and go there. One thing I will say, be sure to advocate for yourself when you're with a doctor. And if you get a diagnosis like this, take a second to breathe. Because we hear cancer, we want it, we kind of panic, and we want things to happen immediately. In my case, I had met with a urologist, and he definitely said, he confirmed that I had cancer. And that was a urologist here locally and in the Dallas area. And, I was immediately like, okay, tell me where to go. I'll go there right now. We'll get it fixed. Thank God my beautiful wife and my intelligent wife was with us, with me. And she was like, okay, hold on. Let's just go get a second opinion, which certainly with a diagnosis and something as serious as cancer, you definitely want to do that for sure. But just know that, take a second to breathe. Prostate cancer moves kind of slow, so it's really important for you to get diagnosed early. The earlier you know about it, the more options you have, and the more you can really kind of take your time. Once we found out, and again, especially at that point, when it was confirmed, I had already had the MRIs and the biopsies and all of that, and it was confirmed, and it was I was on the high risk end of the scale, so to speak, of the Gleason scale. And so we needed to take some action fairly quickly. Certainly, I did not have a year to make a decision. If it's caught earlier, sometimes you can have that, and sometimes doctors will put you on what's called active surveillance. But in all of that, just take some time to breathe, because you're going to need some time to process it.
So you talked about the Gleason scale. For those who don't know, what is the Gleason scale?
So the Gleason scale is kind of the next step, I guess, next measurement, if you will, after your PSA. And so I'll answer that. So the PSA stands for prostate-specific antigen. And we all have it. Everybody has it in their body. It's just when it's, so typically if it is under 4, if your score is under 4 for the PSA, then you're normal. If your PSA is above 4, in my opinion, I'm not a medical expert, but you should then go see a urologist. So I'll kind of put them in bands, if you will. 0 to 4 is considered normal. 4 to 6, you definitely need to be seeing a urologist and decide what action to take. They may say we'll do active observance, or they may say you need more intervention. Anything above 6, you will more than likely have to have some type of surgical or radiation intervention or radiological intervention. And so my PSA was an 8. That put me in the high-risk group. Now, then you go to the Gleason score. The Gleason is typically after they've done a biopsy. And that means they've taken tissue and they've examined the tissue and they've determined that there is cancer present in the tissue. So, again, the Gleason scale goes from, I guess, 0 to 10. Long story short, my Gleason scores at that time were, I had 2, they took 12 tissue samples. 2 of them were cancerous. One Gleason score was a 7, the other one was an 8. Both of which put me in a high-risk category. So, we had that all determined. Now, at that point, that's when we sought a second opinion, and we were, like I said, we were able to get into MD Anderson in Houston, Texas.
So what was it that, I don't know, what was it that made you think you needed to go get tested? Is this a regular thing that men should be looking to do? Were there some symptoms?
Yeah.
Something that made you like, okay, I need to go get checked out. I'm not feeling well.
Great question. This was discovered through my normal annual physical exam.
Okay.
I had no symptoms, which most men that are diagnosed with prostate cancer are asymptomatic, meaning they show no symptoms. Mm-hmm. There are symptoms, frequent urination at night, when you get up 3 or 4 times in the middle of the night to go use the restroom, lower back pain, like severe lower back pain. And those are just 2 that would readily stand out. But there are other symptoms as well. So to your point, it was discovered through my normal exam. And so definitely want to encourage men to make sure that you're being tested for PSA, or that your blood is being tested, getting a PSA test when you go for your annual physical. It's nothing outside of that. It's, you're typically giving blood anyway to run all kind of other tests, and this just makes sure that PSA is part of that testing.
And I think it's prudent to suggest to any men who aren't doing it, get an annual physical, get an annual checkup.
Absolutely.
Because you said it earlier, Mike. We just we feel the pain, we pinch it, we grit and we move on. Or in in your case where there were no symptoms, we just don't think about it. We're feeling okay.
Right.
You know, we grow up in the, I know, you know, my dad was like, hey, you know, you're all right, pee on it. That was his answer to everything, right? Because all of the uric acid and ammonia and you pee on it, that'll be soak it in some pee, right? It'll be fine. But if it's not hurting, you're fine.
But here's the other thing too, though, and so it is obviously it's very important to get your annual exam because it also establishes a trend. And so what happened for me, so from 2022 to 2023, my score had gone up slightly, but it was still in normal range.
Okay.
From 2023 to 2024, my score doubled. And that put me just outside of the normal range, but still okay. From 2025 to 2024 to 2025, it doubled again.
Really?
I should have gone in 2023.
Now, was there anything that leads to that score doubling, or is it a lifestyle? Is it a diet? Is it?
There's nothing definitive, but certainly lifestyle and diet can certainly contribute to that. But there's nothing. That is the thing that, at least in my case, what I was told, and I went through some genetic testing to see if I was predisposed because there was a history of cancer in my family. But they determined that I was not necessarily genetically predisposed. So it impacts people differently. However, now if there's a history of prostate cancer in your family, you definitely need to take some action because more than likely it will impact you at some point. So what I should have noticed, I'll say a couple of things. What I should have noticed was the first time it jumped up, it doubled. I should have taken action then.
The PSA test.
The PSA.
Okay.
I should have taken action then and gone to a urologist. And this is where we had some conversation prior to recording that we have to share. I know men typically don't like sharing certain information about themselves, but had I had a conversation before that, like with Mike or somebody else, they may have said, hey man, you need to go. That's not right.
Yeah.
So there's that. And this is why we also have to, again, advocate for ourselves. I'm going to try to say this. Y'all know I try to be diplomatic. My doctor should have hit me over the head and said, dude, you need to run to a urologist. That first time it doubled. Now, this is where I will own that because we are all responsible for ourselves and we have to be accountable, but not bashing anyone, but you got to trust and verify. You know what I mean? So I wish the doctor would have had a conversation with me to say, hey man, this is really serious. There was information that was just put out on the portal that I happened to read. And the fact that it said at the first time when it doubled to just above that 4 level, and it was like, it's okay. You might want to do this, but you're okay. And so as a man, I'm like, well, cool. Plus, I'm not feeling bad. Why would I want to go see another doctor?
Right.
That was that. But the fact, then when it doubled again, communicated via the portal was, I'm sending you to a urologist. I'm grateful and I'm thankful for that, but that should have happened sooner. This is where your own patient education comes into play. And it's okay, especially now with all the information that is out there, and there's tons of information out on the internet, and I know doctors hate that sometimes, but at least go arm yourselves with it and ask the question and present the questions to them.
Right. Right.
So, yeah, it's like we put too much. We give doctors too much credit. And I don't mean that in a bad way, to the extent that it has nothing to do with their training, that they don't know what they're doing. However, they're just like us. They don't know everything. As much as they study, there's still stuff they don't know. And So there, I felt like there was a way that should have been communicated that it was not.
And didn't you have a similar experience, Mike? In terms of once you found out, maybe you could have learned earlier.
No, my doctor was kind of the opposite of Derrick's experience. He started monitoring me long before it got to urologist point. You know.
Okay.
So once he got and this is, I think, what this is kind of illustrating is, at the time, Derrick didn't. That number doubling meant nothing to Derrick because it hadn't been explained.
Right.
My doctors point blank told me we're gonna watch this, and we can monitor it. If it gets to this level, then we'll go to the next step. He says, but at any point, if it like doubles, then we need to act on that, because that's not, when it does that shows how aggressive that it is.
Right.
I was fortunate and blessed. Mine was low grade. We caught it early, so it wasn't. I could have probably gone a few more years before I did anything. They told me that because it was of the rate that it was growing, and it sounds like Derrick's was growing at a faster rate.
Right.
And that's why you have to just. And this is a part of your annual physical. I think they automatically, once you hit a certain age, they automatically do that.
I think starting at
40 or something like that?
So for most people, they say starting at 45, but for African American males, they start at 40.
Right.
Because I read a statistic one day. It said prostate cancer is the most common cancer among African American males.
I think it's something like 1 in 6, 1 in 7, something like that.
And
men have been diagnosed, black men.
Right. And unfortunately, it has a higher mortality rate, too, with black men because we don't seek treatment.
Right.
For various reasons, be it economical, be it, let's just put it out there. They want to make sure they are able to ejaculate and feel it.
Yep.
And just don't want to do anything that tests their manhood or, their notions of manhood.
So I'm not trying to be funny, but
No.
How does that relate? You said ejaculate and feel it.
So when you go through prostate surgery, there's a level you're going to have to recover. You will have some erectile dysfunction. That's just how it is because of where they are operating.
Gotcha.
And they can do nerve sparing surgery and other things that they can do, but they do impact your reproductive area.
Gotcha.
Because especially if you do surgery, they're going to remove your prostate.
Gotcha.
Right. If you do radiation, they're going to be treating your prostate. Either way, there's going to be some function that changes as a result of that. So, and, kind of step back and just personally, I decided surgery based on some conversations I had and knowing that was the most thorough to get rid of everything. And the other thing, what I did learn, though, is that there's not necessarily a wrong answer in how you as an individual decide to treat it.
Right.
Sometimes it's surgery, or you may opt for radiation, or sometimes you have to do both just as a result of where you are.
Because both of you had surgery.
Yeah.
Right.
Yeah, I had radiation too.
You had radiation as well.
Yeah.
So, and that, sometimes if it looks like it comes, or, it looks like it has a chance of reemerging based on your PSA scores post surgery, then that radiation is an option. But what I did learn is best to do, in my opinion, again, best to do surgery first, because if you do radiation first, radiation can create some scar tissue that makes surgical intervention later more challenging.
Right. And so the theme I'm hearing between both of you is educating yourselves.
Educate yourselves, and especially now. So again, after that urology appointment here locally where I was ready literally to drive to wherever I needed to drive to go get it taken care of, my wife came home, ChatGPT, put in all of my numbers, all of my information, and it, kind of came up with these are the best places to go.
Okay.
So that said, we were, lo and behold, we're looking through the list. You hear the, Cleveland Clinic, Mayo Clinic, John Hopkins, MD Anderson. So we were blessed to be able to go to MD Anderson. We actually had a connection there. So it again, God divinely brought this all together. But given that, there's tons of information out there, and as Mike, we talked about, there's tons of disinformation or misinformation.
And because
out
that's
there
one
as
of the things we want to be very, very clear that we are not medical experts.
We are not medical
and
experts.
we are not trying to offer medical advice
at all. Simply sharing my experience and my thoughts and my opinion.
Absolutely,
period.
Absolutely.
But there's information out there. But I think where we have opportunity, particularly as Black men, we have to get invasive with our buddies. Meaning, if they tell you they're going to the doctor, well, hey man, talk to me. What's going on?
Talk to me. What's going on?
What are your numbers? What does it look like? Okay, hey, if it's this, then you may need to go there. Because what I'm telling people now, again, I'm grateful that Mike had the experience he did with his doctor, because I'm telling people, if your doctor is not acting like that, you need to find a new doctor.
Right, which is where the education comes in.
Yeah, absolutely.
Right, no matter what, no matter how good or bad you think your treatment is, you still have to educate yourself, and you have to get that annual exam.
Start there. That's
Start
minimum.
there.
That's minimum.
Right.
So
I think though too, we got to be careful with it, educating yourself, because I don't know what that looks like, but I think what I would encourage people to do, you need to find a good primary care physician.
right.
One that you can talk to, that you can have questions, ask questions. And for men, I think and this is where I think Derrick and I and other cancer survivors can help, is now you know what to ask.
Right.
Right.
So you're not just sitting there, just listening to whatever he tells you. Because I think once you hit a certain age, you need to initiate. I'm a Black man. I'm at high risk for prostate cancer. Where am I today? What do I need to do?
Is that 50 cents, not cents, that innocence, that weight, that grace, that consequence, my scars, my fate, my documents. Is that 50 cents, say it out loud in confidence. Every line a little evidence. I ain't done yet, I'm a testament. Talk shame, talk hell, talk fathers, talk fear of the call from the doctors.